This video is going to show the pediatric chemo independent double check in addition to the MSKCC's independent double check.
So we are going to double check for the pediatric packet and the orders for Song Jenny. And I have gotten my colleague here to double check with me. So we have Jenny Song, who is on this active treatment. Peds SA, vincristine, dactinomycin, cyclophosphamide, ARST-0531, regimen A, VAC only. We drop down to double check her height and weight and make sure that it's current. So on 4/13, she had her height done. 4/13, she had her weight done. And then we can compare it up here that there is a 0% chance change in her height, 2.2% change in her weight, and only a 1% change in her BSA. We then drop down here to find that she is getting chemotherapy for week 13. Today is day 1, so she does have treatment parameters. We will check from the chemo tab, current labs, looking to make sure that she met her treatment parameters. So we have a platelet count of 298 where it needs to be greater than 75. Her ANC is 3.87, needs to be greater than 0.75. T-Billy needs to be less than 2.1, and her T-Billy is 0.3. We're giving cyclophosphamide, so just to double check for the specific gravity is 1.004, so she has met parameters. The regimen note does not indicate anything specific that we need to know except for cyclophosphamide or guidelines per monitoring information. There's no current treatment note for this particular therapy. We have started our Mesna, and we are giving her cyclophosphamide, 2,300 milligrams per meter squared. No? Packet. Oh. So I'm just going to open her packet. This is for Song Jenny, 8675-30909, is receiving cyclophosphamide, which is what we're going to give her for rhabdomyosarcoma, which is her diagnosis. It is signed by her mother, a witness, and the provider. And she is on vinc, actino, cyclophosphamide as per ARST-0531 regimen A, which is what we reviewed earlier. 0531 regimen A. We're going to give, this is specifications for Dactino. We are giving, so ARST 0531, we are on week 13. VAC, we're going to give cyclophosphamide, 1,200 milligrams per meter squared, 1,200 milligrams per meter squared, over 60 minutes. Down here, we have that it's given over 30 to 60 minutes, 1,200 milligrams per meter squared, and nothing else. Prior to checking the drug against the computer, I am going to compare the drug to the patient's wristband. So we have Jenny Song, MRN 8675-30909, 8675-30909, and birthday is good. Okay. So now I'm comparing the drug to the order set on the computer. I have Jenny Song, 8675-30909, Jenny Song, 8675-30909, cyclophosphamide, 1,200 milligrams per meter squared for a total dose of 2,300 milligrams, over 60 minutes, in the right dilution, expiration date. Everything looks good. So I'm comparing the drug to the treatment plan. And now I'm going to hand it to Dee Dee to independently double check it.
So, all right, so now as the checking nurse, I'm going to compare the drug to the bracelet. Jenny Song, MRN 8675-30909, 8675-30909, and birthdays are the same. And now I'm going to do the same independent double check. So Jenny Song, 1G, Jenny, MRN 875309009, 875309009, cyclophosphamide, 1200 milligrams per meter square for a total dose of 2300 milligrams, IV over 1 hour, and the dilution is straight drug, and the expiration is not anytime soon.
Because this drug was less than 250, I have circle primed the line and attached it to my patient. So I go ahead and program it like I would based on what the drug is. Or 60 minutes. So I have independently programmed the pump based on the specifications of the drug, and now I'm going to call on my colleague to do the double check.
So now that Chris is not standing with me and not reading this pump, I'm comparing what is entered in the pump against this and what we learned from the computer. So I go back to setup and I see that it is 2300 milligrams, 2300 milligrams. According to a BSA of 1.93 is 1192, which is close to 1200. Next, she has programmed it for 60 minutes. I'm following the line, seeing that it is connected. Clamps are all open, and we can then hit start.